All right, let's take a trip back in time to 1987. We're going to talk about an injury that was a real thorn in the side for countless athletes: chronic groin pain. We're going to dive into this really fascinating study that came up with a pretty surprising solution to this super nagging problem.
You know that feeling, right? If you've ever played a sport or even just had a nagging injury, you've probably asked yourself this. You do everything you're supposed to. You rest, you do your physical therapy, you follow all the rules, but the pain just doesn't go away. This was the exact wall that doctors and athletes were hitting back in the 80s. And we're not talking about some super rare condition here. The study actually points out that these groin injuries were becoming more and more common, especially in sports like soccer that are all about explosive sprinting, cutting, and kicking. The people in this study were all athletes, and they were basically stuck. Their choice was either give up the sport they loved or find a better way forward.
Okay, so before they could even think about a solution, the researchers had to get super specific about what was actually going on. And here's the crucial part. Not all growing pain is created equal. They figured out there were really two distinct patterns. And you can see just how different these two types of pain really are. On one hand, you've got adductor pain. That's that classic ache on your inner thigh when you try to sprint or kick a ball. It can even make something as simple as getting out of a car painful. But then, on the other hand, there's abdominal pain. This is higher up, and it gets triggered by quick changes in direction, or maybe even just a strong cough. Getting this diagnosis right, that was absolutely the key first step. So what did doctors usually do for this kind of pain? Well, then and now, you always start with the conservative stuff, the non-surgical route. But as this study was about to show, for these really chronic, long-term cases, that approach was often just a dead end. And this whole playbook probably sounds pretty familiar to you. First, stop playing your sport. Then, do physiotherapy and stretching. Maybe pop some anti-inflammatories. And if you're unlucky, you might even get steroid shots. The whole idea is to just calm everything down and let the body heal itself. It makes sense, right? But here's the catch. Here's the kicker. For the athletes who had been dealing with this pain for months on end, only 38% of them actually got better with this standard treatment. Just 38%. I mean, think about that. For almost 2/3 of these athletes, the standard of care was a total bust. They were still in pain with no real hope of getting back to their sport. This right here is the problem this study set out to fix. So with the usual approach failing for so many people, the researchers started looking at something way more direct: surgery. They decided to build a case for a totally different kind of intervention. The main procedure they were looking at is called a tenotomy. Now, I know that sounds a little intense, but the idea is actually pretty straightforward. It's basically a surgical technique where a doctor carefully cuts a tendon, releasing it to get rid of that chronic tension that's causing all the inflammation and pain in the first place. And what's cool is they didn't just have one-size-fits-all surgery. They tailored it. If you had that inner thigh adductor pain, they did a really small, minimally invasive release of those tendons. If you had the abdominal pain, they'd release part of the rectus abdominis, yep, your six-pack muscle, and then reinforce the area. But for both, the goal was the same: get rid of the source of that constant strain. Okay, so this is where things get really, really interesting. They did the surgeries, and then they tracked the results, and wow, the data they got told a completely different story from the folks who just rested. I mean, just look at these numbers for the adductor surgery. A whopping 81% said their results were excellent or good. Remember that 38% success rate for the other guys? This surgery more than doubled it. It wasn't even close. And believe it or not, it gets even better than that. For the group with abdominal pain, or a mix of both, the satisfactory results shot up to an incredible 94%. 94%. This was an absolute game changer. It offered a real, effective path forward for athletes who had been on the sidelines for months or even years. But okay, there's always a but, right? The biggest question any athlete would have is, what about my strength? If you're cutting a tendon, does that mean you lose power? Well, this might be the most important finding of the whole study. They did strength tests and found literally no difference in power between the patients who had surgery and a control group of healthy athletes. They got rid of the pain without sacrificing performance. And the recovery? It wasn't some year-long ordeal. We're talking about a pretty clear and honestly pretty quick timeline back to playing. Patients were up and walking in just a couple of days,
They were back to running in about 5 weeks, and most were back to playing their sport full go in about 3 months. For someone who's been sidelined forever, that's an amazing timeline.
All right, so let's zoom out and pull this all together. What did this study from way back in 1987 really teach us about dealing with these ridiculously stubborn groin injuries?
I mean, when you put it all side by side like this, the difference is it's night and day, isn't it? For those long-term chronic cases, just resting and doing physio wasn't working for most athletes. But surgery? It was incredibly effective, got players back on the field in around 3 months, and, this is the most important part, did it all with no measurable loss of power.
And this all leads to the final, really fascinating question that the researchers themselves brought up. It's fantastic to know there's a surgical fix that works for these chronic cases, but maybe the real challenge now is to figure out how we stop these overuse injuries from becoming chronic in the first place. And honestly, that's something the sports world is still working on today.